All right, so I'm Dr. Ryan Budwany. I'm an interventional spine and pain physician, and I'm truly grateful to be on this talk with you guys today. Did a lot of my training in Appalachia and under the mentorship and guidance of Dr. Tim Deere at the Spine and Nerve Centers of the Virginias. I recently made the transition here to Bradenton and Sarasota, Florida. I'm really honored to, again, continue that mission that we began in Appalachia and to work to build this forward. So it's exciting to be here. It's an exciting time in our field, and I can't wait to work with our community. So, I'm one of the chairs for the Young Innovators at Aspen, and it's always about pushing the bar forward to do the best we can to serve our patients. That's really the goal of every physician. And in our practice, in our setting, again, there's a lot of challenges that we face. And one of the challenges is in patient education. Again, in our space, the space has changed so much in the last couple of years. We've gone from chronic pain management physicians to interventional pain doctors to minimally invasive spine doctors. So what does that mean? It means that our technology is not able to keep up with the knowledge base that is currently available. So if that is for our APPs that are coming in, or the other physicians that are coming in, or even for the industry that supports us. And so at the core of this is physician and patient-led education. And so the avatar and the AI-based technology that we're working on and that I've worked with, it allows me to use physician likeness technology. And what that does is, in my own setting, in my own clone, basically, which is my avatar, it looks like me, it sounds like me. It allows me to communicate complex medical information directly to my patient. And the way we do that is we actually have tablet-based setups where we provide patients directed physician-led education. So unlike a brochure that a patient comes in and they're given for a specific technology, it's just a random brochure, a generic brochure. This information is actually communicated by my avatar. And again, we disclose this information to the patient with the disclosure at the bottom, but for the patient experience, they know who they're talking to at this point. They know that it is their physician. Again, the script is written by the physician. And we're communicating that information because it allows us to hone in on the needs of the patient. And so, for example, if a patient comes in and the patient's like, hey doc, I'm coming in because I'm having weakness in my legs or I can't walk a long distance, right? When we're working that patient up, even before I step into the room, we've given them curated videos just for them. And so now the downtime where they would just spend time, fiddling on the phone, with Facebook or Candy Crush, they're actually getting pertinent education for their diagnosis. So that when I come in, we can have a more meaningful discussion. And again, we're putting that discussion at the forefront of that patient's needs. And so that's where I've found value. My patients, that's where they've seen that value. And I think that the incredible challenge in this space is that there's so much information. There's a variety of different practitioners out there. There's a variety of different skill sets. And the practice settings are diverse. But the uniqueness in all of this is the physician and the patient relationship. This allows us to enhance that relationship. And so that's why I find it so valuable. Typically now the patients that are coming in, I get to triage my patients. And the more information that's provided to us, it helps us to kind of triage them if they're coming in for back pain or leg pain, knee pain, headaches, a variety of different things that are coming on. And so based on that, the more information we have, we pre-curate those videos so that that's available to them even before I step into the room. Even for some of my patients that are coming in as new patients, they get a text message the day before that, hey, you have your appointment reminder tomorrow, you're coming in to see Dr. Budwany, and we send in Meet Your Physician video. That allows the patient to know what the expectations are going to be for our practice, what the things they need to bring that day, what their goals are that need to be addressed and what they need to keep in mind so that they can actually get those questions answered. And so all of these things are, again, it would have taken a long period of time to sit in front of a camera and record this content, right? And again, now with a avatar-based likeness technology, it allows us to do a brief shooting of that avatar. And once you've done that the rest is it. All you do is review scripts from then onwards, and your avatar and the AI technology does the rest. And so it's really beneficial because it improves efficiency in the practice setting. It allows the patient to get more direct communication, and it gives you consistency in the communication you're providing. And I think that is the authenticity we need to deliver complex information, because patients have to make bigger decisions about some of the care that they're getting. and some of these complex, innovative procedures that we're providing them. Like I said earlier, we're no longer just writing prescriptions for medications or just doing simple injections. We're offering complex, minimally invasive spine surgery. And so that requires us to provide information in a multitude of fashions to our patients. Lots of research out there has shown that actually multimedia usage improves patient satisfaction and comprehension, and at the same time it allows them to stick with the procedure or to stick with the therapy that's advocated for them. And I think that's important because patients want to get better, they want to get improvement for whatever condition they're in. But if they feel like we are not on the same boat with them, we're not actually sharing that same mission, and it's not that we're not doing it, it's just if they feel like the physician may not be interested, or the practitioners that are working with them do not have the time for them, or there's a communication issue, then that can become a barrier. So I find that this AI-based technology is helping to reduce that barrier and ultimately better serve our patients. One thing I didn't touch on is the value in some of this technology is that with a click of a button, I don't speak Spanish, I am a native English speaker, but with a click of a button, now I can actually deliver that conversation in Spanish or a different language that's pertinent to that patient. So again, you're reducing barriers and improving care and access for a patient. So that's truly the goal. And that's really what the goal of that talk was, is to help the greater members of any of our societies understand that this is an available technology. And as far as I'm aware, I'm the first physician in the world, at least in the interventional spine and pain setting, to use this technology. And it's changed the way I'm addressing the needs of my patients. Some of the really interesting things that are going to happen in this innovative space is when they actually go in and they look, if they turn on their camera, now if you're doing like a telehealth video or in our clinic setting, we actually have a monitor now set up, right? And it's set up so that the physician's face is there, and the patient's looking at the avatar of the patient or of the physician, and they actually talk to the avatar, and the avatar responds back in real time. So that's a future rendition of this technology. But again, ultimately, I feel like in all of healthcare, access to care is limited because of just unnecessary barriers that exist. And one way we can do that is, again, we can't duplicate ourselves, but in this way we kind of transcend ourselves. And we use the latest technology to improve access for our patients, to make sure that is pertinent for them so they feel like they are part of the discussion and they get to be at the center of making that decision that's the best for them. Or we were talking about, the kind of the metaverse, right? And you're just living in an alternative reality. And again, some of the tools that are developed for this alternative world, right? We need to bring them back to healthcare, and that's kind of where the advantage is in this, right? Because healthcare is extremely complex. There's so much information, and physicians are burdened with that load of paperwork to kind of keep up with the day-to-day charting, the day-to-day tasks that allow us to provide better care. And so often that compromises the time we have with our patients. But using this AI-generated technology allows us to be right in front of our patients to be able to deliver that care in a more pertinent fashion. So that's kind of where I see this to be a huge advantage. There's very little research right now. I think there's a lot of research that's being done, but very little research that's been published on VR therapy. And I know that in the psychiatry space, this technology has been used and it's shown to be significantly beneficial. So I do see that in the months and the years ahead that this is going to be an option that is available to our patients, because again, mindfulness and the treatment of pain is dynamic. It is not just, hey, this is one problem and we're going to treat the ailment with this written prescription or this one injection, and that's going to fix everything. I think you need to take the multitude of things that are available and address the different issues that are affecting that patient, because pain is dynamic and we need to consider everything that's available to help take care of that issue for that patient. Some of this work actually has been done for our veterans, right? So BAMC, which is Brooks Army Medical Center in Texas, which is one of the largest medical centers that deals with our veterans and our troops that were injured in battle. And there's a lot of recovery that's associated with that. So that technology is actually actively being used in that setting to help them navigate some of those challenges. And so I do see that this is going to hopefully transcend over to the pain space. And again, that type of crosstalk, that type of bridge building between different levels of technology is so essential in addressing the dynamic issues that face our patients today. Chronic pain is a long-term, a lifelong issue that people face, right? And my mission, my passion has always been to prevent the chronicity of pain. I think we're addressing it too late. It's kind of like saying, we want to treat diabetes, but once people have to get their foot amputated, now we're addressing it. And I think that's where the pain space is today, that by the time the patient is almost disabled, we look at the VAS scores and we look at the ODIs and they're almost disabled. That's when we're like, oh my God, these scores are so high, now we need to try to address them and then to try to treat it. And I think that's too late. And so our goal, in this space is to actually hopefully prevent the chronicity of pain. And I think that's important because if you treat these conditions earlier, then you prevent the disabilities that are associated with it. You change the psychiatric issues that are associated with it. And you allow patients to get back to function sooner so that before they actually get issues with their leg or their foot or the inability to do the things they love on a daily basis, you've actually addressed that. So I think as a profession, as a specialty, I think we're treating our patients probably 15 or 20 years too late. I think that if we looked at the functional issues that are facing patients that are 30 and 40 and 50 and address it then it would prevent the chronicity from ever happening. Another example is like pre-diabetes, right? Now, we actually screen for pre-diabetes and we start addressing that with lifestyle changes. So if you take that same type of approach and you say, okay, this person used to go to the gym, he used to be healthy or he used to go to work and he had to change positions because of whatever injury he faced, and then nothing else is done to address that, then there's a lifestyle mechanism that goes into it as well, right? So you address pre-diabetic patients with lifestyle management, right? You get them back to function, you get them back to eating better. All of those things are similar in the chronicity of preventing chronicity of pain. And the way you do that is you say, okay, you injured yourself at work or you had this kind of pain-related issue. Let's go back and look at the functional causes. What's the rehabilitation process that's involved? So we address this now so that you don't end up gaining that unnecessary weight that's only gonna make that pain worse. And so I think that mindset, it can't change overnight, but that mindset needs to change for our entire profession. And I think that dynamic and that change is happening, but it's happening a little too slow. And unfortunately, the casualty in this situation is our patients and their families. And the entire part of this is where we come in. I think that technology can help us address some of these issues. It can make those relationships with patients better because they better understand the care they're getting. But at the same time, we actually as a profession need to change our mindset and say, hey, let's prevent the chronicity of pain. Just like let's prevent the chronicity of diabetes. Let's come back, maybe 5, 10, 15 years earlier and look at the functional issues that are going on, and let's address those things so that people never end up in a situation that they need to have these large spine surgeries because they're almost rendered disabled without them. And so I think that's kind of what my passion is. If I can work with a like-minded cohort of physicians who want to address that, this is everything that I've always wanted to do. I wanted to talk actually about the innovations in interventional pain. I want to talk about innovations in interventional pain and spine management. And so, like I said previously, I serve as one of the chairs of the Young Innovators at Aspen, right, which is the American Society for Pain and Neuroscience. And we've constantly tried to push the bar forward to bring incredible technologies available to our patients so that it addresses those functional issues we were talking about, right? And part of that is that we've kind of moved away just from addressing pain based on the medications or just on injections and doing more functional-based therapy, but as well as minimally invasive spine therapy. So things like SI joint fusions and lumbar decompressions, which required a significant amount of recovery and surgery time. Now that those tools and that dynamic has changed. So let me give you an example. 15 or 20, or maybe even 30 years ago, if anybody came in, with a heart attack or had cardiac-related issues with clogged arteries, you'd break their chest open and a cardiothoracic surgeon would come in and say, okay, this is what we need to do, this is a bypass surgery. But you don't see that happening anymore, right? That entire space has changed. It's gone from cardiothoracic surgery to minimally invasive interventional cardiologists performing that procedure. Just like that, we're going away in our time and in our lifetime. That dynamic is happening right now. That change, that transition is happening right now. So we're going away from these larger spine surgeries to minimally invasive spine surgeries. And this is where the interventional physician comes in, the interventional spine and pain physician like myself and all of these members of these different societies like Aspen come in because we are beginning to see the development of these tools, the research that shows how well these tools work, and the training that goes along with it to address the conditions of our patients. So for example, if a surgery took 3 or 4, 6 hours, these surgeries are taking an hour and a half. The recoveries that took several months from these surgeries, now they're being considered same-day surgeries. So patients come in to an outpatient surgical setting, no longer an OR setting in a hospital, and they leave the same day. So in this situation, the patient ends up doing better because they recover sooner. And so that transition is a really big part of the change of space that's happening right now. And that's something to be kept in mind, because I think that the greatest gain for this is our patient, right? The healthcare costs are significantly less because it's a minimally invasive situation. But our patients no longer have to feel like, hey doc, it's gonna take me 6, 7, 8 months of rehabilitation to get back to function. No, that's no longer the case. It's a couple of weeks and you're back to function. And so with this kind of situation, I think we all win, because again, we're addressing the pertinent needs of our patients and using innovative technology, both through AI technology, but at the same time, dynamic and changes in minimally invasive spine surgery that we're able to adopt and bring to our patients to address their needs. Well, the American Society for Pain and Neuroscience, I think it's the largest interventional spine and pain society that's out there. And really, the interest is because we are at the forefront, at the cusp of this cutting-edge technology. And a lot of it is driven by these minimally invasive spine procedures or these changes in neuromodulation technologies that are available. And so the reason that I believe our members benefit from that is because, one, we have the research to show how some of these technologies work really well. Our industry partners support by teaching our fellows and our young physicians the advanced technologies and the innovations that are available to them. And at the same time, it is allowing us to actually work in a very interesting time. It's allowing us to use these procedures that patients did not have access to, and now it's available. And so this is the society that's actually leading the way to make this available in the hands of every interventional spine and pain physician out there. I would really encourage everybody to come and see us in Miami. This is the home base of the American Society of Pain and Neuroscience. And our meetings are always in July, because it's really the best time for us to kind of collaborate, to share ideas, to share thoughts on innovation, better serving our patients, and leading the way and really changing the way our patients experience some of the pain and how we actually get rid of some of this pain, how we manage their functional outcomes. And so it's truly an honor and a privilege to be part of this society and to be able to actually support some of the innovation that's taking place today. So ISPN is the international version of ASPN, and our first meeting was in Dubai, and our upcoming meeting will be in London in 2025. And again, it is just the ability for us to collaborate on a global level to address some of these incredible issues that our patients are facing. And again, if it was not for our industry support, the young innovators, and all the physicians that have a legacy of hard work that's gotten the society to where it's today, we would not be there. And so it's a huge win for all our patients and our community, and really the entire medical field, because now more than ever before, we have the ability to truly transform the way patients are getting access to this care, improving recovery and improving function, and hopefully reducing the chronicity of that pain. Aspen has incredible leadership. The founder, the CEO is my mentor, my good friend, Tim Deere. Without him, I think that our space would not be where it is today. He's really done a lot to shape and transform the entire space. And at the end of the day, the people who have succeeded in this and who've done well are really our patients. Our patients have really done well because of some of these innovations. And at the end of the day, they're the ones who win, because we've all collaborated, we've worked so hard, and we need to continue to push the stride forward for them, because again, if you remember, not too long ago, maybe 10, 15, 20 years ago, the opioid epidemic was truly destroying our society. And in Appalachia, where we're trained, this is common. Everywhere you looked, patients were suffering, and we couldn't really offer them anything else but med management. And so with innovations like this, with advances like this, with the collaboration from Aspen, we've really changed the technology that's available to our patients. So no longer do we have to write a prescription to address the pain. Now we can offer interventional therapies that are changing their functional quality of life. And I think that's a huge win, and it would not have been possible without the mentors like Dr. Tim Deere. So I'm incredibly grateful for all the support. But more than anything else, I'm grateful to be part of a society that encourages innovation and it encourages the service and the support of our patients, because that is why we're all here today.